Hi everyone, I'm Lisa, and that chocolate lab that you've seen on some of my other videos is Jezebel. Like I said, she's my 8-year-old chocolate lab that developed a CCL tear about 3 weeks ago. Oh, going on 4 weeks, it'll be 4 weeks tomorrow. So I'm going to actually document Jezebel's treatment and her therapy so that if you were like myself and you were in you find yourself with your fur baby having a CCL tear, and if, they say, you got to do surgery, you got to do TPLO surgery, it's going to get them, functioning faster, prevent osteoarthritis, but yet you just either, one, you can't afford it, or two, you just don't feel that it was right, which was happening in my situation. That I just, after the amount of god-awful amounts of research that I have done on all the treatment modalities for treating a CCL tear, I just did not feel that TPLO surgery was best for my dog. That was just my own personal thing. So then I was on a crusade basically to figure out what I can do for her. I still wanted her functioning. She's a young 8-year-old. She's still very, very happy and active, and I wanted to keep her that way. And so that began my research, probably like many of you guys who are probably in the similar situation, debating about, do I do surgery? Do I not do surgery? There was just too many possible what ifs and complications for surgery for me to feel comfortable. And which is weird for me to say because I am a surgical nurse. I've been in the OR for over 17 years. I do a lot of elective surgeries and I assist in them, and I'm very pro surgery. So when I found out that Jezebel had a CCL tear, of course, number one treatment, they say the gold standard is that TPLO surgery, get them back functioning faster. Even when I consulted like a physical therapy place to try to just maybe do, rehab that way, they recommend surgery. Although I have a very good primary veterinarian who was more than willing to work with me, whatever I decided to do for Jezebel. So, and he was not obviously abreast of a lot of the holistic side for treating a CCL tear. He did fit for some stiffle braces. If that was the way that, I wanted to go, he would have done that for me. So, I have chosen, which is to work with a holistic veterinarian and do what is referred to as prolotherapy. If you guys aren't, not familiar with it, I don't know if there's veterinarians in your area that offer something like this. I found a veterinarian out of Royal Oak, Michigan. I'm based in Michigan, the suburbs of Detroit, and currently we're in a polar vortex of minus 35 degrees. But anyways, which actually is perfect timing for me for this to possibly happen. That means I can probably rehab Jezebel a lot easier because it's easier to keep them in the middle of the snowstorms versus if it's summertime. Anyway, so I've started to upload. I just uploaded a video of Jezebel about a week ago, how she was walking. I went over some of the supplements that I was on and that we were doing, waiting for my prolotherapy today. I think might have given you a little bit of a background of everything. Like I said, about, she blew her CCL about almost 4 weeks ago at this point, and it took a long time to get in and to see my veterinarian, and then to get into the rehab place to have a consultation there, and to get into the holistic veterinarian. It's like, one appointment a week. Now, the one thing that I will stress is that conservative management, at least the route that I'm going, may not necessarily be cheaper than doing surgery, where some people may not have that surgical, have the money to be able to go the surgical route. For me, they quoted her surgery around $3,000. It was going to be anywhere between $3,000 and $6,000. Some of the downfalls of the TPLO surgery for me personally, obviously anything from, obviously there's anesthesia issues, you can have infection issues, you can have human error, surgeon error in that, aspect. Also, a lot of the research that I have been finding lately is that now that TPLO surgery has been around for a while, long-term studies are coming out showing that a large percentage of dogs are developing osteosarcomas in the site of that osteotomy. So again, then I'm thinking, okay, great. So I'm do the surgery to try to make her better, to get her functioning faster. Yet on the other hand, I kill her with bone cancer. That just wasn't a risk that I was willing to take. So a lot of the conservative management treatments that I'm going don't have a ton of downside. There's always a downside, and there's always a risk with both, whether conservative management or if you do surgical management. There's no guarantees on either way. There's no guarantees that surgery will work. There's no guarantees that conservative management will work. Some people won't even treat it at all. Some old school people are like, give them some Rimadyl, some anti-inflammatories. Don't, kind of keep them quiet for 6 weeks. Don't let them jump on things. Don't take them for a walk. And at 6 weeks, slowly start increasing their activity. I mean, that's what I've heard from some other vets. Also, the other thing about the TPLO surgery is that a lot of times, especially in labs, they normally say within 18 months, anywhere between 40 and 60% of dogs will end up blowing out their other CCL, because during that rehab, time, they're putting so much stress and strain on the contralateral, on the other knee, basically, and so they end up blowing that one because they're, while they're rehabbing the first one. So I've done a lot of research on the different stifle joint braces. The brace that I've decided that if I choose to do it is probably going to be the A-Track Dynamic brace. I haven't bought it yet. I wanted to see how her prolotherapy went first to see whether I needed to buy that one or not. You can buy it yourself. You can, I believe so, because it said vet pricing and retail pricing. So you can be able to, you are able to order, or you can get it through your veterinarian as well, because they do want a tibia measurement via x-ray, which my veterinarian gave me without a problem. So Jezebel had her first prolotherapy today. I dropped her off at the veterinarian. They gave her a shot, some sedation. They took her back. They did a quick x-ray of her hip as well to make sure that we didn't have any arthritis on that right side that, we're going to be dealing with as well while we go through this therapy. At 8 years old, she doesn't have any arthritis in her hips or her knees at this point. So this is going to be a long-term goal, me trying to help prevent this osteoarthritis from setting, and obviously, or reduce it from happening. So they gave her some sedation. They got the x-ray, they shaved the knee. They do like a full, kind of like a surgical scrub on it. Then he had multiple injections with the dextrose solution, and he uses ozone, which is for like an antibacterial, anticidal, kind of prevent any infection from happening with the injections along the lateral portion of the knee where the CCL tear is. Now, the other thing they do not believe, of course, it's really hard to tell, that her patella is, that the meniscus is involved. She doesn't have any clicking, or sometimes if you have clicking, sometimes, a meniscal tear can be part of the problem as well. And obviously you don't really know, even on x-ray you can't tell, and sometimes even only once you go in for surgery you can tell whether or not there's a tear, but there's no contraindications whether she had a meniscal tear or not with doing this prolotherapy. So, and one of the videos I had mentioned about some of the supplements that she was on, like I said, that cytokine therapy. The only other thing that was added now today after doing the prolotherapy is the antibiotic that I just threw on the floor. She's on Keflex. She's going to be on Keflex now, just for 10 days, 500 milligrams. Actually, I think it's going to be 1,000 milligrams twice a day, because I think they're 500 milligram caplets, and I'm going to do 2 twice a day for the next 10 days, just to make sure that there is not, to prevent any infection or anything from happening in that knee where he did the injections at. And that's just a precautionary. So other than that, I think I uploaded a video of Jezebel kind of walking right now. Now, he did say, though, that also she's going to be even more gimpy today. But it's just like if you or I were to have a cortisone injection in our knee. I mean, little sore and a little bit inflamed when it first happens, but give it a day or two, you know, for everything to start, you know, settling, and she should get better at that point, but it's completely normal. She's just kind of sleeping and you know, a little bit. I gave her, although she was sitting by my little one trying to get some treats, so that's back to her normal thing. And one of the things, like I said, if everybody is into, you know, the research like aspect of it, like I was, one of the things that Dr. Simon gave me was this pamphlet on the cytokine therapy, which is a very interesting read. And then also, if you're interested in like his, he also writes me notes too for the Prolo ozone therapy. These are some of the doctors that you can research as well that were kind of like, I think, the pioneers. And actually, I know, Dr. Bronstein is a holistic doctor in our area. I think he might even be maybe like an ND that uses prolotherapy in humans. And so you know, you look that therapy up. It's quite interesting. Of course, I liked how this page, you know, if you are reading this in a clinic waiting room, is because your doctor has joined the ranks of forward medicine and uses cytokine therapy in this practice. So, so then I did ask Dr. Simon if I could take pictures of the waiting room and everything, and as well as like pictures of all of his certifications and everything and his, you know, qualifications. And he was okay with that, since none of them have like his address or anything. So just to show, you know, his qualifications and whatnot, so that if anybody, especially in the greater Detroit area, is interested in consulting with him, you guys, you know, then you guys will have his name and whatnot. And if you want to, you know, have your dog treated by him, I feel comfortable and confident that this is going to work. And not have to go to the surgery. Like I said, it's not that it's going to end up any cheaper, at least for me, because I think I'm going to do some physical therapy with her, which is like the underwater treadmill, you know, work right now. But I just think this is a better option. And my goal is hopefully by the time the summer, because I live in Michigan, you know, we've got a ton of snow right now, that by the time the summer comes and everybody in Michigan goes up north and we have a place up north on a lake, that she will be able to be swimming out in the lake this summer. So that is my goal. And you know, hopefully a lot of you guys will be joining our journey. And for those of you who either had, you know, pets that have had the surgery or had pets that had the CCL tears, or people who are just being diagnosed, having your pet being diagnosed with CCL tears, just know that, you know, we are all, you know, I'm support. I ended up watching some videos about people who treated their dogs CCL tear without the surgical treatment, and just being able to watch other people's plight and to know that it is possible and I can do it, and Jezebel will be okay, then that meant the world to me. So that's why I'm going to start, you know, documenting Jezebel's journey, or our journey, because it is a whole family thing. You know, she is part of the family just as much, and so that's the thing. If you guys have any questions or want to know more about the supplements or anything that I have for Jezebel, I've never done a YouTube channel besides for my ghost hunting business. So I don't, you know, I've never done a personal one, but if there's any questions, I will try to answer them. If you're interested in some, like I said, whatever therapies that we're using and some of the supplements that we're using, or if you guys have your own personal experiences and if there's anything that you guys have done that has worked, please let me know, because I am very open to learning all of the possible treatment modalities that I can possibly do for Jezebel that does not obviously involve surgery. So thanks so much.